Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, where we explore the intricacies of tocilizumab and its role in medicine. I'm your host, Dr. Shikha Agrawal, and we are joined by Prachi Virat, our passionate microbiologist. Welcome to the show, Prachi. Let's focus on immunity in today's episode. Tocilizumab and immunity in context of understanding the impact on immune function.
Happy to be here again, Dr. Shikha. It's always a lively and thoughtful conversation.
To start us off, how does tocilizumab actually impact the immune system?
Tocilizumab works by blocking interleukin 6 receptor, which is a crucial player in immune signaling. By inhibiting this pathway, tocilizumab can reduce inflammation and modulate immune responses. While this is beneficial in conditions like rheumatoid arthritis and cytokine storm in COVID-19, it is also mean that immune system's ability to mount certain responses might be dampened, particularly against infections.
Excellent overview. Thank you for breaking that down so clearly. Now, what are the potential implications of this immune modulation for patients on tocilizumab?
Great follow up, Dr. Shika. The main implication is an increased risk of infection, especially bacterial, fungal, and opportunistic infection. In addition, this can be blunted acute phase response, so markers like CRP might not rise appropriately during infection, making it trickier to detect early signs of sepsis and other conditions. That said, for many patients, the benefits in controlling their underlying disease often outweighs their risk when managed carefully.
Really helpful context, Prachi. Thank you. Can these effects on immune function be managed or mitigated while patients are on tocilizumab?
Absolutely. Regular monitoring for infection, baseline screening for latent tuberculosis, and appropriate vaccination before starting therapies are essential steps. During treatment, clinicians often maintain a high index of suspicious for infections and monitor patients closely. If serious infections occur, tocilizumab may need to pause. Guidelines from bodies like EU, LAR, and ACR have detailed recommendations for managing these risks.
Appreciate those practical insights, Prachi. How does tocilizumab's impact on immune function compare to other biological therapies?
Great question. While all biologics targeting immune pathways can increase infection risk, the profile varies. For example, TNF inhibitors like adalimumab and etanercept can also carry infection risk, especially for tuberculosis and fungal infections. However, tocilizumab unique suppression of the acute phase response make detection of infection more challenging, which sets it apart. In contrast, agents like rituximab, which deplete B cells, have different risk profile, including delayed viral reactivations.
That comparison was really useful. Thank you for clarifying those differences, Prachi. Before we wrap up, what would you say are the key takeaways for our listeners when it comes to tocilizumab and immune function?
I would say the main message is that tocilizumab is a powerful anti-inflammatory therapy with proven benefits. It comes with immune-related risks that need to be actively managed. Regular monitoring, individualized care plan, infection vigilance can help ensure that patients get the benefits while minimizing potential harms.
Wonderful summary. Thank you, Prachi, for another informative discussion. And to our listeners, we appreciate you tuning in. Be sure to subscribe, share, and join us next time. Until then, stay curious.